Tonight, a 6 on Your Side investigation. An elderly Fremont veteran claims Omaha's VA health system admitted to misdiagnosing him with a serious heart condition.
That led to unnecessary and expensive treatment. As Brandon Scott reports, that veteran is now stuck with the bill.
Looks like your balance here is more than $1,200.
Yeah.
Larry Brown contacted 6 on Your Side to help him make sense of a growing stack of medical bills. Bills Omaha's VA health system refuses to pay, even though Brown, who is 72 years old, is a Navy veteran who served in Vietnam and Japan.
I don't think I let people down when I was serving, and I don't really expect the VA to let me down either, but I feel like they have.
In 2014, Brown's VA doctors diagnosed him with atrial fibrillation, an irregular heartbeat which can lead to blood clots, strokes, and heart failure. He was put on blood thinners to reduce his risk. Then, late last year, Brown checked himself into his local emergency room.
I just didn't feel right.
Brown didn't know it at the time, but he was bleeding internally.
Brown's local ER doctors called the doctors here at the Omaha VA to arrange a transfer, but the VA didn't have enough beds. So Brown was taken by ambulance to Nebraska Medicine, and after several days of treatment, he racked up a $15,000 bill.
Shortly after he was discharged, Brown got a phone call from the VA asking him to attend a meeting with his VA doctors.
What did they tell you?
That they had made an error with my heart monitor results. They had confused them with another patient.
Meaning Brown was misdiagnosed in 2014 for atrial fibrillation. He didn't have it after all. And those blood thinners he was prescribed, they could be the cause of his internal bleeding, which led to the giant medical bill, which the VA won't pay. Brown says the VA told him it can't pay the bill because Medicare is supposed to do it.
Whether it's Medicare or whether it's the VA, do you have any preference as to who pays your bill as long as it gets paid?
I very much care. I feel that the VA hospital was at fault, and it should be their responsibility to cover that.
Now that you've been through all of this, what do you think about the VA? Do you have confidence in how they treat you and their patients?
Now my trust and confidence level is down to about 0. I don't believe the doctors anymore. It's just taken away the trust that I had.
With producer Roger Hamer, I'm Brandon Scott, WWT 6 News.
We contacted the Omaha VA about Brown's story.
And we heard back. In a statement, we're told the VA does not discuss patients' health care situations publicly to respect their privacy in accordance with the Health Insurance Portability and Accountability Act of 1996. However, VA takes patient concerns very seriously and has a process to look into complaints to ensure we are providing excellent health care that ensures the health and well-being of all enrolled veterans. And since this all started with switched medical records, we also asked about the other patient involved, the one who actually had atrial fibrillation. We asked if that patient ever received a proper diagnosis and treatment. The VA did not have an answer.